Welcome to the Latam MedTech Leaders Podcast, a conversation with leaders who have succeeded or plan to succeed in Latin America. Please subscribe on your favorite podcasting platform: Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, and others. Today, our guest is Riley Normandin, Director of International Sales at AMD Global Telemedicine. In this capacity, Riley is helping new and existing telemedicine programs find the best solution to fit their program needs. AMD has over 8,500 patients endpoint installations in more than 96 countries and delivers preeminent telemedicine solution designs, turnkey installations, and training for telemedicine programs across the globe, including Latin America. So, Riley, it's great to have you here today. Thank you for joining our podcast and the episode today.
Thank you for having me, Julio.
Fantastic, Riley. So let's get started by talking about your involvement with Latin America. How do you first get your contact with the region on a personal or professional level?
Sure. So when I joined the company about 11 years ago, we company had been in business now for just over 30 years. But when I first joined, we had done business deploying hardware telemedicine devices to a lot of countries in Latin America, but a lot of that was, only government based or grant based care, which is what the telemedicine market was at the time, where it was a lot of grants, right? Reimbursement hadn't really been um, fine tuned. So from there, it's grown with kind of the adoption of telemedicine in general. So we've been able to help programs or countries, I should say, you know, initially start their pilot programs when they're trying to say, hey, what is this telemedicine thing I keep hearing about? And from there, from it's a lot of shared experiences with other countries, and they're able to grow. Whether it be in Bolivia, where we've done some big programs to, uh, some in Mexico or Paraguay. There's a number of ways that we've kind of reached the Latin American region. Um, some easier than others,
Yeah,
right? Yeah.
sure. And you've traveled all over the region, I guess, or a few select countries, right?
Yes. All I have done quite a bit of travel to the region. Um, I've a lot of countries that I've checked off, and quite a few more that I are on the bucket list to visit. Hopefully soon, when the world gets back to normal.
Yeah.
Yeah.
Good, good. All right, Riley. Let's talk about trends that you see happening in Latin America. What economical, social, political, or epidemiological trends you see happening in Latin America that are good for your business or for the business of commercializing medical technologies?
Sure. So um, I think there's really a couple ways to look at it, right? So the telemedicine market in general has been growing. Say, I think the numbers pre-COVID, it was growing 15% year over year, and now they're saying that it's with COVID, they expect it to be about 20% or more year over year, because what it's done is it's accelerated the adoption of telemedicine and telehealth in general. Um, a lot of the um, the countries in Latin Central America, in the U.S. and really globally, it has one of the big barriers pre-COVID was making the average patient understand what telemedicine or telehealth could do. What were the benefits? Um, and because of the way the world has been for the last year and a half, a lot of people have been forced to have their first telemedicine or telehealth consultation, um, whether they like it or not, and they've seen say, oh, you know what, this isn't um, you know a robot doctor, which is actually what a lot of the perception was, that hey, I want to talk to a doctor, I don't want to talk to. So they've seen that, oh, I'm still talking to a doctor or a healthcare professional, um, and it's convenient. So the adoption has really grown. So it has also made a lot of countries kind of revisit what their telemedicine policies were, regulations, for sure. Some, I think, for example, in Brazil, prior to COVID, the Brazil wasn't doing a lot of telemedicine, um, because their policies and frameworks were that you needed to have it had to be doctor to doctor, right? So there was no you had to have the patient could be involved, but there had to be a doctor on both sides. So it was mostly being used for second opinion, which has some value, but that's a very small piece of it, right? So now they have they have loosened that framework or legislation to allow the patient to schedule an appointment within certain parameters for to see a doctor. Um, One thing that's halting the growth completely is that they haven't set a definitive regulation for the country yet, right? So they've set it as a temporary policy to allow these types of consultations to take place, but they haven't said that it's this policy is going to be there moving forward, so that's kind of in limbo. But I think what, just like most of these other countries, they're seeing that the adoption um, has grown, the convenience of it, and the power that it can have, and I think most expect it to become more of a permanent
Yeah.
policy. It makes too much sense not to.
There's no turning back, I think.
No, exactly. Right.
Once you have a taste of it, I just had mine for my first time ever. I'm 50 years old. I just got my first telemedicine consultation about a month ago for an eye infection that I had. I'm like, this is so convenient. I don't have to travel anywhere. I have to park. I don't have to dress. I don't have to do anything.
Yeah,
I mean,
I know.
24/7. It's so convenient. I mean, they prescribe my medication, go to the pharmacy and pick it up, and that's it. Simple.
Yeah, yeah,
So, I'm so glad to have you here today because this is a trending topic. And I recently interviewed a fascinating guest who is like you in the telemedicine world, but he is a dentist, a very prominent dentist. He's from Venezuela, but he's been in the States for over 20 something years. He's licensed in about 10 different states in the United States, and he's leading a teledentistry initiative for a major teledentistry company in the US that is looking to venture into Latin America. So I'm like, wow, I mean, now you can have dental appointments online or via telemedicine. This is really fascinating.
yeah. It is, and I like to joke that I mentioned I've been with the company for 11 years, and for the first 10 years, if I was ever at a cookout or somewhere and someone asked me what do you do for work, having to try and explain to them what telemedicine was difficult. And now for the first time I say it and they say, oh, I know what that is. So it's nice. Yeah. But
Yeah, I think it is in everybody's mind that online first, that mentality, that online first for shopping and also for medical appointments. So the first thing you will think is, let's have a consultation online. It's like recently I need to speak with my attorney, and having spoken with him in about a year. And then my first reaction is, let's send him an email and let's have a Zoom meeting, even though we are in the same city in
Yeah.
Orlando. I mean, like before COVID, that wouldn't have been possible.
No.
People will immediately assume we have to meet in person, face to face. I have to dress. I have to schedule time for travel to his office. I have to wait in his waiting room, and then I have to enter his office. I have to have the conversation with him, and then drive back to my place. So it will probably be a 2 hour deal.
Yeah.
Whereas now is I spend about 15, 20 minutes with him on Zoom, and that's it.
Yeah.
So
And it's better for another one of the interesting parts of the adoption has been along with the patients for forever thinking that, oh, I want to talk to a doctor, I don't want to talk to a robot. A lot of the doctors for so long have had this misconception that telemedicine is designed to replace them,
oh
right? That forever, that's still
yeah,
something we work with, but thinking that, oh, they're automating everything and they're they're going to replace me. I'm going to lose my job, and it's now a lot of these doctors and healthcare workers are realizing that uh, that's not
yeah,
the intent, right? It's supposed to be a
exactly.
tool to see more
Yeah, yes,
patients.
to see more patients.
Yeah, and it's making best use of resources, right?
Yes.
Um, I had mentioned the briefly that project we did in Bolivia a few years ago, where and not a challenge that was unique to Bolivia, but in a lot of these rural areas that are underserved, and a lot of the people living in these underserved areas had limited access to care, or and the providers or the doctors, they don't want to live in the rural areas, right? So um, the government put in telemedicine at 340 locations in these remote municipalities, and overnight, whether they lived in a rural area that was 12 hours away from La Paz, uh, they now have access to the same quality physicians that someone does that lives right next to the hospital in La Paz. So it's kind of uh, leveling the playing field for everybody. That's what it. Yeah.
Yes. Yeah. That's great for Latin America, and the region badly needs solutions like this. So let's talk a little bit about that project. I mean, how was people's reaction? I mean, you were telling me a story about people embracing you and so happy to see you bringing this technology. Let's talk a little bit about that for listeners.
Sure. Sure. So that project started in 2014, in the Ministry of Health at the time. Uh, their focus was uh, it was increasing access to care for, it was pediatrics and women's health. That was their main focus. They wanted to increase the infant mortality rate and maternal mortality rate, and uh, you know a great way to do that or address that is increasing how or routine care for these pregnant women, early, so they can be seen by a doctor early in their term. So that was a that was the focus. So each village or each municipality had received a telemedicine cart that had an ultrasound on it, a video colposcope, vital signs monitors, essentially all the medical devices that could be used to examine uh, examine the patient as if they were right there with the doctor. Um, and I had the opportunity to go down when we first started, and to go to one of these rural communities and help with the initial launch and kind of installation. It was in a rural community, um, the Seguidero, and I probably am pronouncing that wrong, but uh, uh, I traveled out there, and when we set up the equipment, they had a patient there ready to be examined, and it was a woman that was pregnant. She was probably 7 or 8 months pregnant, and they said she had 4 children, and this was the first time that she had seen a doctor during any of her pregnancies. And me looking from the back of the room um, while they're talking afterwards, she was so grateful for the ability to see a doctor, and it was it's something that it really touched me because it's something that is right. I'm in the business of telemedicine, but being able to see something like that firsthand is really powerful, and it still gives me goosebumps a little bit talking about it because it's one of the more rewarding experiences I've had since I've you know started with the company, being able to see it firsthand and how because I think from what the people I was there with were um, translated to me is that she felt like she what her, for lack of a better term, like her self-worth or value was on par with everybody else. She wasn't a forgotten person, and it was um, yeah, it was a
Very
really cool
touching.
moment.
Very
Yeah,
cool
very
moment.
touching.
Yeah, yeah, yeah,
Yeah,
yeah. Wow, fascinating. I mean, I'm really happy to hear these success stories in Latin America, and we need a lot more of that, of those success stories in the region. I mean, even in a developed country like Colombia, I'm sure there are areas like that with people like that who have never seen a doctor or very rarely see a doctor.
right.
So, let's move to other countries. I mean, what in what other countries have you had experience or have you seen adoption taking place in Latin America, Riley?
Sure. So, different levels of adoption. I think there are a lot of countries that, um, like for example, Chile is a has done a fairly good job of having some telemedicine frameworks and policies, right? So they're Chile as a country has been pretty good, and I think a lot of what's currently probably separating the adoption in certain countries is um, if it's the government or the Ministry of Health hospitals that are deploying them is having a program, right? Protocols and processes are probably the biggest, um, or not having them is probably the biggest inhibitor of having a successful program, right? We've had a number of countries like that have purchased or deployed a couple systems, but they do that without having protocols in place on okay when are they going to use it, what is the um, process for saving the data. um, Colombia, I think recently has put in the early stages of putting a lot of good regulations and policies in place. Like interoperability is a big one now. So having the ability to have a central electronic health record system for the country where, um, you know, regardless of where you live, the doctor, when you're seen, they can pull up your record and see, okay, I can see that you had um, a ophthalmology exam a few months ago or a diabetic screening test, and they can pull up those results. Um, so Colombia is on the right path to having a really well developed and well structured program. Um, yeah, I mentioned Chile, Brazil. Hopefully, we'll get there. Peru is also starting to have some the structure or the policies. Um, and in Paraguay, we just did a deployed a decent sized project where they're starting to again, it's a brand new project beginning of last year, but they're putting the policies and guidelines in place for a lot of these remote municipalities, because a lot of them, what they're trying to do is, for one, keep their doctors. Um, you know, they don't want them moving to another country. They want to make best use of their resources, um, and you can have one doctor provide care to many locations at one time. So it's also a real cost savings too, because they're not just primary care in remote areas. It can specialized care. The distance might be, you know, 15 miles, but if there's a lot of traffic, um, that may be an hour and a half drive. So, right? So having a specialist that can connect while you're still at your physician's office or wherever is valuable. And it can be places like schools or prisons, where you need to provide some level of care, but I'm sure doctors aren't lining up volunteering to go provide care in the prisons, but you still have to provide some level of care, so um, you're able to provide them access overnight using the same doctors that you have.
Mhm.
Yeah.
So it's my impression that Latin America is still a few years behind the US and Canada or North America in general, or perhaps Europe. But the way I see things unfolding in Colombia, Riley, and you have probably noticed this or not, but the recent regulation in Colombia, was reading the law about a month ago, and in preparation for our interview and the interview that I just had with this dentist that I just mentioned. And I see that they created a new category of healthcare provider. They created something called an orientation service, which is different from the healthcare providing service that is currently in place. In other words, what I'm really saying is that it looks like in Latin America, governments are trying to protect the current infrastructure of providing healthcare services, which is brick and mortar, right?
Right.
A building, a clinic that is inside a wall, that wants to have a telemedicine program because they want to keep their patients coming in because they have to pay their bills, have to
Right.
make money somehow, and regardless of being private or public, but they have to keep patients coming in. So they take the initiative with their own resources or a grant or whatever. They have their IT people implement a telemedicine program for them and just for them. And the clinic next door will probably do the same. And the one a mile away will probably do the same. I don't think we are ready in Latin America to see virtual clinics 100%, because probably the regulation is not there to enable or to certify a clinic that doesn't exist in the physical world. You see what I
Right.
mean? In
Yeah.
the US, you see already different virtual clinics, 100% virtual. I mean, staffed by doctors, where a patient can just connect on a cell phone, on an app, and via a chat or a telephone call or a video conference call, they can talk to a real doctor or specialist. In Colombia, for example, that's not the case. You can only have 100% virtual teleorientation services, where they can direct you to the right doctor, and they give you the phone number, or they connect you, they patch you in with the right doctor. That is working at a clinic that is a brick and mortar clinic in
Right.
the traditional world. In whereas in the US or probably Canada, you have already the framework, the legal framework for healthcare services to be provided 100% virtually. Is that your take in Latin America or
I
not?
Yeah, yes, but I also think part of what you described is okay, because even in the U.S., right? So I would say there's two types of telemedicine or telehealth. There's the um, you know talking to a which is direct to patient, which is talking to the doctor, having a video call on your phone, or having a Zoom call, um, which is great. Which adoption has soared during COVID, right? Uh, that is great for a few reasons. One, quick, easy access, um, follow ups. Late at night. I know I've used it with a newborn baby. It's 1 a.m. and she, I'm a new father and kid's making a sound that I've never heard before. So, calling the doctor, say, hey, is this normal? Yeah, it's fine. Those type of things. But they're also, with those services, you are limited on what you can diagnose as a doctor without medical devices, right?
Okay,
Uh,
yeah, but that's a physical limitation of the actual
a
devices.
physical
Yeah,
limitation for
yeah,
sure,
yeah, yeah.
but you are limited legally on what they can diagnose or prescribe, right? So you can't. They're not allowed to prescribe any controlled substances,
Okay, yeah, it makes
um,
sense.
and so you are your hands are tied a little bit as a doctor. They're used a lot of times for referrals, saying, hey, you know what, I am going to refer you to another doctor, or I think you should go see a specialist at this location, um, because you know they need to either have a more hands-on consultation, or maybe they'll refer you to a telemedicine clinic, something similar to like the Bolivia
Yeah.
system, where you have a mobile cart and medical devices that isn't staffed by a doctor, but the doctor would connect to you in real time to be able to look in your ears, of your eyes, take your vitals, things like that. So, um, I think you're right in that it seems like at this stage, a lot of countries, they're trying to find the ways to um, what are the incentives for the doctors to do it, right? Um, or the hospitals. It's they're trying to maintain their patient base. Um, and is it who's paying for the services, those type of things. So those are um, you know there's not a universal answer to that,
Yeah.
and it seems to
Yeah.
vary by country, or continent. It's all over the place. So hopefully we're getting somewhere where it's all easier to regulate and
Yeah.
legislate.
Exactly, exactly. It's about time that we kind of expand our horizons on what healthcare is provided. I mean, in the way healthcare is provided, that doesn't have to be limited to a brick and mortar area,
Right.
and that's kind of the mindset that Latin America has to kind of overcome, right? Eventually, we're gonna get there. I mean, slowly we're doing it. COVID accelerated the adoption of different technologies in different areas of the economy and our lives. I just read yesterday in Colombia now public notaries can notarize documents online. There's a new law for that, which is fantastic. I mean, it's been already out there in the U.S. for probably 5 years, but it's good to see countries like Colombia already adopting these newer technologies. So
Absolutely.
yeah, yeah. Anyway, so Riley, let's talk about how how what do you need to make this work in a deployment in a country? I mean, what are the pieces that you guys as in AMD put together? I mean, let's talk about a typical deployment.
Sure. So one of the really nice developments in the world over the last, what it seems like, maybe 5 years or so, is that uh, broadband internet has been so much easier to get in all of these countries and around the world. Really, it's not perfect by any means, but it's a lot easier and more affordable than it was, 5 6 years ago. Um, and one of the uh, I think the Pan American Health Organization said that they recommend, I think, a minimum of 1 megabit per second for internet for it to be reliable and stable. And now that is a lot more attainable for a lot of these rural areas. Um, so typically, to when we start deploying or helping a country start designing their telemedicine program, we go in and we tell them, okay, there's let me take a step back. When we talk to someone, a lot of say, hey, we want telemedicine. Um, what do we need? The reality is that it's not a one size fits all type of technology, right? So if their focus is on pediatrics and women's health, like Bolivia, then they don't need maybe they don't need the dermatology equipment or an ophthalmoscope. Look at the eyes. So or how is it being used? Is it being put in the back of an ambulance to do house calls? Um, so maybe it needs to be it needs to be portable and easily carried. So depending on how it's used and kind of what is the medical focus, because that's the most important part, is why do you want to do it? That's how we help them determine what accessories, what devices um, need to be deployed. And then the second part is, how is your health system going to deploy it? What's your workflow, right? Where are your doctors going to be? And a lot of programs already know and have an answer for all of this, right? I think with the adoption, the uh, education on what telemedicine is taken such a significant leap over where it was a few years ago. Where you asked me 5 or 6 years ago, when I started talking about workflow and where your doctor's going to be, a lot of these organizations were like, "Oh, I didn't even think about that. I don't know." Now they already say, "All right, yeah, we have a plan in place." Um, if they don't, we help them with it, but um, helps them so that they shouldn't have to change the way that they treat patients. Right? Uh, Telemedicine should help them. It should not hinder anything that they're doing. So think of it this way: a doctor should still be able to, if there's 5 clinic rooms in their hospital, and if they have a patient in clinic room 1, a patient in clinic room 2, they may also have a clinic and patient in clinic room 3, but that patient happens to be 100 miles away on the other side of the country, and they're being seen through a monitor. So they should not have to change the way they deliver medicine. It should be easily adaptable, so that that any data that they collect can go into their existing health record system, because those are the things that are important. Uh, Telemedicine is so far past the proof of concept stage, or even the pilot stage, that um, it should be just an added tool to help improve the way they deliver care.
Okay, so AMD is a consultant. It's a system integrator. You guys don't manufacture devices. You incorporate whatever device is needed for the specific application or purpose of the telemedicine program.
Right, exactly. We provide what we make and develop is our software, and um, we take, the medical devices. We're an ISO certified um, organization, but we take third party devices, or devices that we distribute, and we integrate them to kind of provide whatever it is outside of like invasive surgery. We have hardware and devices that can be used in every type of medical specialty or however they want to deliver care. So we'll do that, and we can help train them and deploy them, and kind of help them put the protocols and processes in place so that once they start using it, they keep using it. Because one of the in our experience, we've deployed, the majority of them are extremely successful, but those programs that aren't successful, or maybe the equipment isn't used as often as they should, is because they don't have those processes in place in the protocols. So eventually it stops being used and starts to collect dust because the staff stop using it, and then there's turnover, and someone new is coming in saying, I don't know what
Like a
that
new
is.
government or something
Yeah,
like happened in Bolivia.
that's
She
right.
told
That's
me
right. Yeah.
that's too
Yep.
bad. That's too sad. But the change of government. I mean, the mothers are not seeing doctors as frequent as before. Hmm.
Right. Yep. I
Yeah.
know.
All right, Riley, we're close to the end of the show. The last question I have for you is, what would you say to the CEO of a medical device company that is just starting to look at Latin America as a place to do business? What do you think about the region? What's your perception about the region? What would be your muscles of wisdom to him?
I I think I get very I get very excited about the prospect of the region, right? I think that it is, um, in my experience, especially in telemedicine, I think it's the fastest growing region in the world. It's the
Wow,
region
that's
I'm
great
most
to hear.
excited about. Yeah. So I think that there's such a large opportunity um, in a lot of uh, these countries like Brazil, Peru, where a lot of the telemedicine space is largely untapped, right? And a lot of uh, in Brazil, in Visa is so prohibitive for medical device regulations, or it's not prohibitive, but it's just a long,
Yeah,
painful process
yeah.
that you know the opportunity to get in these early stages and put your stamp on the telemedicine market as it's growing, I think is huge. So um, yeah, I think that it's uh, hopefully 12 months from now, we'll be sitting here talking about how unbelievable the last 12 months have been in Central and Latin America, and um, I think it's a very exciting time for medical device companies and healthcare companies in the region.
Excellent, Riley. I'm really, really happy to hear that. All right. Thank you so much for accepting my invitation to being in our podcast. And I look forward to being in touch.
Yes, excellent. Thank you for having me.
Bye bye, Riley.
Bye.